In the program, we not only focus on deaf women but also deaf girls, especially on sexual and reproductive health and rights. This is because historically in Kenya, deaf women have been facing a myriad of challenges like abuse and lack of career guidance, making girls think of marriage immediately after finishing school or being stranded for not knowing what to do next. Hence the establishment of this program where we can guide girls on what next after high school or what to do in case they are violated. And as a result, we currently have many deaf girls and women who know their rights and know what to do in case their rights are infringed. So we kept on going till 2022 when we got a good funding from BF. This allowed us to establish a physical office, and I know a few of you got the opportunity to visit the office. Till date, the program focuses on school-going girls in different schools between the age of 12 and 24. And this is mainly because they are still at an age of growth and learning, which is essential for their future. Previously, our focus was on advocacy on matters of deaf women. But we did a strategic shift to focus on adolescent girls. And we are currently working with 7 schools from different regions where we take girls through sexual and reproductive health and rights, help them know their rights, which is part of the presentation that I'm going to do today. On the other hand, when Kenya experienced destructive floods, many schools were forced to close down. And we as FEDWEN, we sat back and thought, what can we do? So we came up with another program, and we started by meeting few parents of deaf kids, because at that level, the biggest barrier is communication. We also met the chief and had deliberation on how and what they can do to help the deaf in case of disasters. We met other stakeholders, for instance, Kenya Red Cross, that focuses on disaster mitigation and rescue, to see what they can do to be inclusive to the deaf community. For instance, disaster and emergency communication that is not accessible to the deaf, or how you can come up with an alert system that is accessible to the deaf community to help them be aware of disasters when they do occur, and what to do in case of evacuation and all that. Another area of programmatic focus is parents of the deaf kids, because within a home setup, communication between the deaf kid and their parents is a challenge. So we train parents on sign language for them to be able to communicate with their deaf kids. Over the years, we have also worked on gender-based violence, because in Kenya we have many deaf women who experience violence and not knowing what to do after that. We have done advocacy to ensure that police stations have a police person who can sign. We have also worked to ensure that we have nurses trained in sign language. We have also been advocating with policymakers to ensure we have laws that support the rights of deaf persons. And we have been working with them at an advisory level to help them understand the needs of the deaf community. On matters climate change, we as FEDWEN, we are a member of Nairobi County Climate Change Committee, where we take part in discussions that will ensure that deaf community is also included. At the moment, we have 20 deaf persons who have been trained on matters climate change already. And this is just a snippet of what we do as FEDWEN. And if you want any more information, please meet me in person or visit our booth. So now to our presentation. The title of my presentation is Empower to Impact, Strengthening Deaf Adolescents voice in Kenya. Next slide, please. My presentation has 4 agendas. Number 1, understanding deaf adolescents in Kenya. Number 2, the role of IKID Club, where IKID is an acronym that stands for I Know, I Decide. Number 3, strengthening voice and agency. And lastly, partnership and future. Allow me to start with a brief introduction. Before we started the program, I Know, I Decide. It was our belief that if a deaf child has access to information, they can use that information for self-advocacy, for decision-making, and it will boost their confidence. And this is why we started this program. And we started by visiting a number of deaf schools, around 6 of them, where we had engagement with deaf kids to evaluate how much information they have. And it was our finding that deaf kids had limited information compared to their hearing peers, even in the age of technology. Because in that, there's still communication barrier. You have barriers at home, barriers in school, barriers within technology, making access to information limited for them. And this is why I Know, I Decide was born. So after survey and when we were doing program design and thinking on who will be in charge of training the deaf kids in schools, we thought and decided to leverage on the landscape of Kenya, where we have a number of deaf teachers in deaf schools. So we selected a few and trained them on how to become trainers, because it is, I believe, deaf to deaf interaction is more efficient. So we selected teachers from the 6 schools and did a TOT on them. Yes, they are teachers and they have pedagogical skill, but we had to train them to align with the objectives of our program. And after that, we placed 2 teachers per school. And the progress has been tremendous. On partnership, the program is still looking forward to having more partners. We are currently working with Ministry of Education in Kenya. We are also working with Ministry of Health, because the aspect of sexual and reproductive health and rights fit into these dockets. We are also working with local administration and looking forward to more partnership. Next slide, please. Next slide. I believe I had briefly touched on some of the issues here, but what is the landscape of Kenyan deaf adolescents? 1, we have limited access to inclusive education. Yes, in Kenya, the government established inclusive education, but it is yet to meet the needs of the deaf students, 100%. Secondly, we have societal misconception and discrimination towards the deaf people. Thirdly, we have barriers to effective communication that affects deaf participation. We also have psychological challenges as a result of isolation and stigma. So a deaf child feels mainly isolated after going back home from school. On sexual and reproductive health and rights, there is insufficient access to information. And lastly, we also have limited platform for decision making that are inclusive for the deaf child in Kenya. All these factors leave the deaf child far behind compared to their hearing peers. Next slide. Next slide, please. I had previously touched a little bit on the IKID club, which is already established in different deaf schools and led by deaf teachers within the schools. The IKID program aims at developing self-advocacy skills because many deaf students lack self-confidence that affects their ability to do self-advocacy. Secondly, it aims at fostering informed decision making. In case of abuse, the student will know what to do next. The program also aims to build leadership capacity amongst deaf students. So these three are the main objectives of the program. Next slide, please. The strategies of empowerment that we employ centers on one, knowledge is power. It is our belief that knowledge is truly power, and when a student is informed, then they have been empowered. Secondly, we do utilize peer mentorship programs where within the school, the older deaf students are put in a position that they can guide and inspire younger members. We also use expressive arts and storytelling in sign language by employing mediums such as drama, poetry, visual arts, and etc. And lastly, we do community engagement. This is to ensure that when this deaf child goes back home, they are self-confident and the community is ready to involve them within the activities of the community. Next slide, please. Now we are going to look at what has been the impact of the program from its start to date. As a result of the program, we have seen increased higher education attainment among students. We have also witnessed enhanced self-confidence and communication. If you visit a number of these deaf schools, you'll find that we have students who are able to confidently express themselves without shying off. As illustrated on the photo on your left shows students who are freely engaging and discussing what their challenges are. On the right, you have a photo of a girl who is able to stand in front of people and express herself confidently. Next slide, please. We have a number of impact stories, but just to proceed mentioning a few. As a result of the program, we have advocacy for policy change and community leadership. Most of IKID alumni members are now part of the community where they are able to express the issues and challenges of the community and advocate for them. The photo on your right shows a deaf alumni of the program who is part of community leadership, not only restricted to deaf-based organization, but also mainstream organization. This is an impact of the program. Next slide, please. Now, about our measurable progress. For the 2 years that the program has been working, the report has shown the following. In the deaf schools where IKID clubs were established, we found 85% improvement in confidence compared to the period before the program. We have also seen 400 students enrolled in IKID clubs where they've been able to access more learning materials and information. 70% of our students have also been actively participating in community advocacy initiative and leadership. Next slide, please. Now I want us to watch this short video for a few minutes. If you can put the video on. So after 2 years of running the program, we visited the schools to do evaluation. Can we put the video on, please? Is the video available? Are we having a technical issue with the video? Okay, I'm told that we can't play the video. Let me jump straight to challenges we still face. Our number one challenge has been insufficient teaching and learning resources. Yes, we have developed some learning materials, but we are not able to adequately supply them to students. And our mission is we want to have materials that can live beyond a cohort to ensure sustainability of the program. However, we are still limited on that. Secondly is the issue of funding. The fundings that we have are not sufficient to cover more deaf schools, hence we are limited to only 6. Third is time constraint, working within school environment. They have their program running from 8 to 5. Now leaving less time in the evening for an hour or 2 hours when students are free for us to run the program. Thirdly is parental engagement. We work with students while in school. However, it's difficult when they're at home, especially since their parents are not fluent in sign language. And lastly, within the era of technology, we are not that advanced in this aspect. Really not advanced. And therefore, we still have digital and information gaps. Next slide, please. Having taken you through the history and journey of FEDWEN, these are our future objectives. One is we want to expand our partnership and work with organizations that share the same objectives as we do to help scale up this program to more deaf schools. We also want to increase our funding portfolio. Without funding, we are really stuck. We want to increase our funding portfolio to be able to reach more deaf students. And our aim is also to increase opportunities for deaf students to engage in national policy discussions, be it policy on persons with disability, deaf people must be involved, be it policy on education, and many others. On technology development, we want to develop a digital learning platform. And lastly, we want to champion sign language rights as fundamental human rights. Sign language is officially recognized as the third national language in Kenya, and we want to ensure this is evidently practiced everywhere. And by doing so, break communication barriers. Next slide, please. And lastly, I want to thank you for empowering voices and creating a future. If you have a voice, you have a future. A bright one for sure. So your support is vital in strengthening their voice and ensuring that there is impact. As the program says, I know, I decide, we empower, they impact. And that's the end of my presentation. Thank you.